Hey everyone, Dr. Milani. Today's video is relatively important because we're going to be taking off our bandage. So before we take off our bandage, I kind of want to help you get set up the right way. We'll take off our bandage on the second day after your procedure. That's the most common time. Now, if your bandage became loose over time and it started migrating up before the 2-day mark, then we're going to take off your bandage at that point. So in order to get prepped, I tell people you want to take off your bandage right before you want to take a shower and you're willing to wash your new grafts. That process, in general, even though taking off the bandage takes less than a few minutes, the first shower and patting dry can take you up to 45, so just make sure you have that time. Go through your little goodie bag we gave you after procedure. I want you to pull out 3 things. Number 1 is your baby shampoo. This will allow us to wash your hairs, take a shower afterwards. Number 2 is your gauze. This will help you kind of pick up any drainage, which should relatively be gone, but also if you feel like you got one in the shower and just want to touch up a few spots, this is really nice. And then some bacitracin packets. This is something we gave you a goodie bag. If you did not get the goodie bag, obviously you have a tube of bacitracin, also known as neosporin or polysporin. Any one of those is fine. On that, you just want a basic towel and a face towel to help you dry off. So let's go through how we're going to remove the bandage. The bandage is an elastic band and has padding in the back. So we're pretty much going to cut it in the middle and we're going to let it kind of fall off towards the back itself. That's way it's not hurting any grafts. We're not going to pull it up. The way I did this is I got a pair of small nail scissors. You can pretty much use anything as long as you feel comfortable just slipping it under the dressing itself. So I'm going to pick up the dressing and I'm going to lift it up from my scalp and I'm just going to start snipping away. I'm going to feel that tension come off and then I'm just going to let it fall back on its own. You might feel some discomfort in the back of your scalp, but that's going to come off and you just let it fall away. Sorry, in the back of your scalp, you'll see the area that was shaved and a little bit of redness and a little bit of rawness. Otherwise, you shouldn't notice any bleeding or excessive drainage. Just take a look at your bandage. You can see that this is what mine looks like. If you had a clot of blood, just make sure that that's not actively going. It really shouldn't be at this point. You would have noticed beforehand. Okay, so the next step, if we're not planning to take a shower, you're just going to want to take one of the bacitracin packets. And these are kind of like pre-dosed to the amount you want to use. Use a scissor to open it. You're going to spray it on your fingertips. And again, this is just if you're not getting a shower or if you take off your bandage prematurely. And you're just going to put it in the spot. And you might notice a little sensitivity and a little burning sensation. That's all normal. Just kind of spread it through the area. And that amount of bacitracin should help cover your entire scalp no matter how many grafts we took out. For the bacitracin, you're going to use that twice a day for 5 days. That is including the time your dressing was on, because there was bacitracin in there. So 3 days from the day you took it off, or 5 days total, depending if you took off your dressing earlier. That's the length of bacitracin you're going to use. After that, it can cause some irritation, and we just don't want that. All right, so I'm about to show you how to wash my hair grafts in a separate video, but thank you for watching. Hopefully this helps when you take off your bandage.